Many people are worried about whether the American healthcare system has the appropriate workforce to care for tens of millions of new patients. Do we have enough primary care doctors, enough nurses, and other health professionals? Let's look at that issue. Yet another area that the Affordable Care Act tried to address were concerns about potential physician shortages, especially shortages of primary care doctors. A lot of people worry that if you add 30 million more people to insurance plans, that you're going to increase the demand for doctors. This is going to create long waiting times at physicians and long waiting times for services. My own view is that those concerns may be misplaced. Nevertheless, the Affordable Care Act tried to preemptively address many of those concerns, especially, as I mentioned, the concerns around primary care. One way they did it was to increase Medicaid payment for primary care. The Affordable Care Act expands the number of people who get Medicaid, and yet Medicaid pays a fairly low rate to doctors, and therefore many doctors don't care for Medicaid patients. To ensure that there would be enough physicians caring for Medicaid patients, payment rates to primary care doctors who take Medicaid patients was increased to Medicare rates. In addition, there was a 10% temporary bonus payment to primary care doctors who care for Medicare patients. That bonus payment lasts from 2011 to 2015. In addition, there are many other efforts to try to enhance primary care doctors, including the accountable care organizations, or the ACOs that we mentioned before, that really empower primary care doctors in how they manage patients. In addition, there was an expansion of the National Health Service Corps. This is a program that forgives medical student loans in exchange for people going into primary care, doing dental medicine and mental health medicine in underserved areas, whether it be the inner city or rural areas. In the past, the National Health Service Corps forgave $35,000 of medical school loans, and in the Affordable Care Act, that was increased to $50,000. It was hoped that that loan forgiveness would induce more doctors to go into primary care and to go into underserved areas. There are also grants to help minority students go into nursing to increase the number of nursing students. Those are various provisions that expand the quality of care in the American healthcare system, get more doctors and hospitals to adopt electronic health records, enhance prevention, and ensure that we have an adequate workforce, especially of primary care physicians. Now, to pay for all of that, there are provisions in the Affordable Care Act to raise revenue. As we mentioned before, the President had a very important requirement when we passed the Affordable Care Act. That is, about half of the funding should come from cuts in existing government programs, and half of the funding would be new revenue. And there are a number of sources of new revenue. One is the Cadillac Tax, and this takes us back to the tax exclusion. Remember, the tax exclusion means that an employer who provides insurance to their workers and pays for part of that insurance, that portion is not taxed as income or payroll on the worker, and that is excluded. That tax exclusion is worth about $250 billion a year. The Cadillac tax was meant to sort of disincentivize very luxurious and comprehensive health insurance plans. And basically the way it works is that any insurance plan that's over a threshold will have an extra 40% tax. The Cadillac tax is actually the very last provision in the Affordable Care Act to kick in, and it kicks in 2018. And it says that any amount of health insurance over $27,500 for a family of four will be taxed at 40%. And this incentivizes reconfiguring health insurance to keep that premium low, and if it goes above that threshold, it gets taxed. Over 10 years, it's estimated the Cadillac tax will raise $111 billion. People who don't get health insurance, or employers who don't offer health insurance, they will be assessed a penalty for not fulfilling the mandate. That's worth about $158 billion. Because of the expansion of health insurance, drug companies will probably be making more money. Insurers will certainly be making more money, and device manufacturers will be making more money. And the Affordable Care Act assessed new taxes on each one of these actors in the health system to help pay for the expanded access, and their tax is relative to how big their market share is. In addition to all of those, high-income individuals have to pay more for their Medicare. There's an increased fee for high-income individuals to pay for Medicare, and there's a new 3.8% tax on unearned income, that is capital gains and other income that doesn't normally have a Medicare tax, only for high earners, and that generates a substantial amount of money, $318 billion over 10 years. Finally, there are sort of what the tax people call cats and dogs, lots of other taxes. Just for example, tanning salons that are not essential for health and actually probably bad for health in terms of increasing skin cancer are also taxed and to help pay for the Affordable Care Act. So we can see that the Affordable Care Act is actually a very comprehensive bill in 906 pages. It's much more than access. It addresses cost control, quality, prevention, and the workforce. And the reforms don't go into effect all at once. They are being rolled out from 2010 to 2018. One of the first provisions to be rolled out was covering young adults on their parents' plan up to age 26. That went into effect within 6 months of passage of the Affordable Care Act. And the very last provision, as I mentioned, is the Cadillac Tax on very high expense health insurance plan. Now, the Affordable Care Act, whatever its advantages, is far from perfect. No piece of legislation will be perfect. As they often say, you shouldn't look at the sausage being made. On the other hand, it does importantly transform the healthcare system in a way that hasn't been done in over 50 years. Simultaneously, it's hard to argue that the Affordable Care Act is a government takeover of healthcare. The fundamental aspect of the Affordable Care Act, the exchanges with private insurance competing for individual customers who choose which insurance company they want with the assistance of a government subsidy, is anything but a government takeover of healthcare. Similarly, the government incentivizing hospitals to provide safer, higher quality care, or incentivizing hospitals and doctors to adopt and meaningfully use electronic health records is hardly a government takeover. It's an incentive for the private sector to expand the quality of care that they're giving to people. So the Affordable Care Act is a very large, far from perfect piece of legislation, but moves in many, many areas to improve the American healthcare system. Next, we're going to look at how the Affordable Care Act was implemented and some of the problems with implementation right out of the box.